This presentation, provided by Advanced CPR Solutions, is entitled The Do's and Don'ts of Head-Up Position CPR. In this presentation, we'll highlight some of the current best practices for performing head-up position CPR. We will also discuss approaches that should not be taken. We hope this presentation helps you learn how to optimize outcomes for your patients using this CPR advance. This presentation is part of a series of educational videos that should be viewed together. In order to best understand this technique, you should first be familiar with the science of head-up positioning in resuscitation and the application of the Elegard patient positioning system. And note that any benefits or clinical improvements discussed here are based on preclinical and limited clinical data. Elevating a patient's head during CPR should be approached deliberately and with great care. When done correctly, following evidence-based practice, it has the potential to provide great benefit to the patient in sudden cardiac arrest. Like other CPR interventions, if it's done incorrectly, it could be harmful. Raising the head during CPR is often referred to generically as head-up CPR, but the elevated CPR method is a scientifically based, technologically advanced technique. It includes performing device-assisted head-up CPR with a progressive controlled sequence for a multi-level elevation of the head, heart, and thorax. And this needs to be done in conjunction with the best practice standards for resuscitation. The elevated CPR method involves more than just raising the head. Using the Elegard patient positioning system and following a simple process can help create the best possible conditions for circulation during CPR, which could lead to improved neurological outcomes for your patients. Using the Elegard system also helps avoid potentially harmful errors that can occur with simply elevating a patient's head during CPR. So let's first take a look at the do's for this new approach. First and foremost, you need to start high-quality CPR and keep it going without interruptions. But what is high quality? High quality means right rate, right depth, and allowing for full chest recoil. Full chest recoil is often neglected, and it's critical for preload or the refilling of the heart with blood before the next compression. The benefits of the elevated CPR method start as soon as the Elegard is placed under the patient. Just like starting compressions immediately or defibrillating as soon as possible, starting the elevated CPR method right away is crucial. As soon as you place the patient into the Elegard, there's a slight elevation of the head and thorax. This has been shown in preclinical studies to immediately lower intracranial pressure and improve cerebral perfusion pressure when compared with conventional CPR in the flat position. Using this new approach increases the importance of using additional tools or circulatory adjuncts to move blood more effectively through the body, especially since blood needs to be pumped uphill to the brain. Research shows placing adjuncts such as an impedance threshold device, or an ITD, also known as a rescue pod, is crucial before starting the progressive elevation. So, start with high-quality CPR, then add an ITD to the airway as soon as possible. But remember, an ITD only works when the airway is sealed. This can be done with a continuous two-hand mask face seal technique, a supraglottic airway, or an endotracheal tube. Research shows that additional circulatory adjuncts will further aid circulation, either manual active compression-decompression CPR with a rescue pump, or a suction cup-based mechanical CPR device like the Lucas. Even with an ITD and active compression-decompression CPR, getting blood moving during cardiac arrest is like operating this hand pump. You must first prime the pump to start the flow of fluid moving and keep it flowing. It's the same process during cardiac arrest. You need to prime the head and heart with high-quality CPR and don't stop. Using circulatory adjuncts, start the blood moving through the entire cardiocerebral circuit before trying to pump it uphill to a raised head. And research shows the best results are obtained with 2 full minutes of this priming. So, provide high-quality CPR with an ITD in the low position for a timed 2 minutes before starting the controlled progressive elevation. Additionally, research has shown that the elevation should also take place over 2 minutes. With that approach, researchers showed greatly improved blood flow to the heart and brain over conventional CPR in the flat position. And in animals, there was a 6-fold increase in neurologically intact survival versus conventional CPR. But another key element to the science is that researchers didn't just ramp up the patient, they elevated the head and heart to different heights in a controlled, progressive manner. This ensured the best possible blood flow. A multi-level elevation in a controlled sequence with a final height in line with these research findings provides near normal blood flow to and through the brain and heart during cardiac arrest. Using the Elegard system allows you to consistently deliver the timing and multi-level elevation in line with the research. And this new sequence can be seamlessly integrated into a comprehensive resuscitation bundle, but you need to practice. Coordinating all processes and practicing as a team is key to a smooth and effective resuscitation and potentially improved outcomes from sudden cardiac arrest. A modified or ad hoc approach to head-up positioning could be harmful, so here are a few important things that should not be done. Don't use a whole body tilt. Tilting the whole body upward or just raising the head of the stretcher makes it nearly impossible to perform manual CPR correctly. It can contribute to the Lucas device slipping, and it could result in pooling of the blood in the legs and feet. And most importantly, it does not achieve the multi-level elevation that's necessary as evidenced by the research. Also, don't raise too quickly. This will result in a rapid loss of blood pressure in the head, similar to standing up too quickly after bending over to tie your shoes. Research has shown that these errors will actually decrease blood flow to the brain over the course of the resuscitation. While using the Elegard helps to avoid these common errors, it's important that you remember these final don'ts. Don't forget to place the ITD and maintain that sealed airway for circulatory support. Fluid flows much better through a closed circuit. And don't forget to prime the pump for that 2 full minutes before beginning the elevation sequence. In summary, elevating the head and thorax during resuscitation could lead to significant improvement in neurologically intact survival if we don't elevate without using an ITD or lose the airway seal. Don't forget to prime the pump. Don't just raise the head of the stretcher or use a whole body tilt. Don't raise the head too quickly, and don't interrupt compressions. And if we do, ensure high quality CPR above all else and place the Elegard system as soon as possible. Do use circulatory adjuncts, including an ITD, and maintain the airway seal. Do prime the pump for 2 minutes and use a controlled multi-level elevation. If you remember these do's and don'ts and practice them as a team, you should be able to provide more than just head-up CPR. You should save more lives.